welcome to another episode of Cancer Tamer. I'm your host, Dr. Charley Ferrer. And of course, with me is Debra Santulli-Barone.
Hi there. It's good to be here again.
Awesome. I'm so glad you're here with us. And of course, we have a special guest today who is Dr. Isaura Gonzalez out of Staten Island. So welcome to the show.
Thank you for having me.
You're welcome. So today we wanted to talk to you all about depression and about identifying what happens when we get depressed, and as well as what that looks like. Because there's so many ways that we can manifest depression and show depression, and sometimes it's not seen immediately. So Dr. Isaura is going to talk to us about that.
So what is your title exactly?
I'm a clinical psychologist by training and education, which means that my professional degree is in clinical psychology, and all of my experience has been in clinical psychology. I've owned a practice here on Staten Island for, I want to say, probably the last 14 years. It's been a pleasure to serve the community, and it's an honor to be here to be able to serve your audience today.
Thank you.
I know I go and see you for coaching and stuff like that, and it's, you know, I find her wonderful. So if you want somebody that's really wonderful, you know, go and check her out. And one of the things that we always talk about is doctors, psychiatrists, psychologists, any doctor. It's, you know, my analogy is like a pair of shoes. If it doesn't fit, then go to someone else. There's always a choice that you can make, and whatever feels most comfortable, because we always resonate with a different person. That's the important piece.
Right, and if you don't feel that it's comfortable, you're allowed to dump.
Which Debra loves to say, dump the doctor.
And then you'll find you have to advocate for yourself.
Yes,
you know?
you do have to advocate.
You don't have to
we always
feel
talk
you
about
have
that.
to. Yes.
Yes. So again, whatever feels comfortable for you is what you should be doing. And so Dr. Isaura is going to talk to us a little bit about some of the ways that we can see depression, whether it's in ourselves or with others. We always talk about individuals that are going through cancer, but you don't have to have cancer in order to be depressed.
Right.
You can just be depressed for a vast number of other reasons. And so what are some of the ways that we can look for it or see it manifested?
Well, I just want to take a step back, if that's okay. This question often comes up, you know, is it my hormones? Is it my environment? And the answer is yes, yes. And so some depressions are known as environmental, because external, and it's what's going on around us. It's our environment, it's our situation, potentially our jobs, our health, things going on for other people around us. If we're in school, whatever the situation is, it's external. And then there's internal depression, which is your hormones. And so, or a medical condition. So diabetes is known to exacerbate depression. Thyroid conditions is known to exacerbate depression. There's a lot of medical conditions that are known to exacerbate depression.
And there's also the medication that you're taking can also bring on a depression. Or exacerbate already
symptoms that are low-lying that you potentially weren't even aware of that are depression. And so one thing that I think is important for individuals to understand is that when you're depressed, you may not even recognize that you're depressed. In Spanish, I say, es traicionero, la depresión es traicionera. And so in English, it's like it's treacherous.
Right.
It's a betrayal, because you think you're okay, and then all of a sudden you may wind up in a psychiatric emergency room, or you may
or have bad thoughts.
Or bad thoughts, or potentially harming yourself. And by that I don't mean, you know, physically trying to kill yourself, but doing things that are so harmful, like not eating, like not taking care of
drinking,
driving crazy,
driving crazy,
rageaholics,
putting yourself in positions where it becomes dangerous to your health. And so I think that becomes super, super important for us to understand, you know, that we may be depressed, but because we've shifted from what our baseline is, sometimes we don't even recognize that we're in a depressive state. and that becomes crucial. So if that's something that you may be concerned about, I think taking feedback from people that are around you that know you best.
That can say, hey, I'm seeing something different with you. How are you behaving? You're not normally that way.
Absolutely. Or even just asking very simple questions like, let's say you're at work, has my work performance changed in the last 3 months, 6 months, a year? Okay. Same thing at home. You can ask the relatives that you live with or the people that you're with, have the activities at home changed? Right. Those are markers. Those are things that are quantifiable.
Right.
And it's also when you start isolating yourself, so we can start talking about ways that it manifests. So you may not see it, but other people may see it. Oh, well, you canceled on me 3 times.
Right.
Or
don't answer the phone anymore.
Or you don't answer the phone, or you're usually outgoing, go out for dinner, and now you don't have the energy. Or no, I'd just rather stay home tonight. So it manifests in those ways. It shows up in those ways where you don't even notice it. It's like, oh, no, I'm too tired today, or I've got other things to do. And your friend is going, well, you've canceled on me 3-4 times already.
Right, that's true.
And so there's an issue. Let's address it. Otherwise.
But I think it's hard to face it or even know it, like you said. And then if you do talk to your family and they tell you, okay, this, and that, this is how you're acting, a lot of people are in denial, or they're going to get angry and say, no, that's not me, or whatever, because they really don't see it. I think sometimes it creeps so slowly, and then there's a point where that fine line of going over the edge. Because I know even with times where I've been depressed and I felt I was in this whirlpool, and little by little it was sucking me down, and I kept wanting to climb back up. And then there's a point where you just feel like, oh, let them suck me down and just, let me have some peace. And you don't mean to think that way. It's nothing you plan, but at that moment something snaps and you're ready to actually harm yourself. And, and thank God if you could pull yourself out of that. Yeah. But I think sometimes a person doesn't see it. And that's why, that's why there's that fine line where somebody does commit suicide. It wasn't something, I don't think, that they were thinking for months sometimes. It's just something that gets so dark, and boom, it happens. And it's horrible, I'm sure.
And that's why having somebody there with you,
right.
Or if you don't have somebody there,
right.
You don't have family or close acquaintances,
yeah,
then
you
there's
have to
always
reach out.
Reaching out, or especially for those individuals that are going through cancer. We've advocated before, talk to your social worker, talk to your nurse navigator. Mm-hmm. They can also pick up stuff. Get involved in support groups, get involved in community groups. Even if it's something where you need to push yourself for just one, or also doing things for somebody else.
Yeah,
because
that's
sometimes
a good feeling.
that's a great way of being able to overcome the depression, or at least keep it, a little bit more leveled, where it's, well, I'm doing something for somebody else, and that gets you out of your depression.
Right.
One of the things when we started this show, it was, 2 months after my first surgery, mm-hmm. and I was like, no, I don't want to wait for the show. I want to do it now, because that's going to keep me sane. Yeah. That's going to help me, not be depressed and not do things. And so being able to find ways, being able to find activities that you enjoy.
Well, you have to be very careful, because you don't want to put yourself in a position where you begin to mask the symptoms.
Right.
And you then still have the depression, but you're still functioning. So those individuals are known as functional depressive individuals. You have a functional depression. And so you can get up and go to work, but that's about it. Or you can get up and you can volunteer, and that's about it. Or you can go and you can walk the dogs at the shelter, but that's about it. Yeah.
But it's a start. It's a way of being able to at least bring yourself into doing one thing, so that your life doesn't become nothing.
Yeah, but I see what she's saying, because people that want to not think about it, they just keep busy. And they think I'm fine, right? Totally busy, and they think they're okay. So they're running away.
What I'm saying is that involving yourself in a community activity or a purposeful activity, which is what I'm hearing from you, let's find some purpose. Right. Which is wonderful.
To keep you from getting isolated.
To keep you, exactly, right. To keep you from getting isolated, I think is crucial. But a person who wants to isolate will find the way to isolate. Which is also kind of, that's why I said it's very treacherous, because sometimes people say, well, I never realized that they were that depressed, or I never realized they were that isolated. I never realized, because functionally they appear to be a functioning member of society. They appear to be engaging in their bills. They may pay their bills on time. They may not look what a typical depressed individual may appear, or what we see in the media or social. Exactly. And so just to go back on your signs and how does it manifest, or what does it look like, typically depression has a very wide range of a look. So you have your functional depressive individuals that go and work and do things at the minimum. But then we also have individuals on the other side of the spectrum, which you wind up seeing that they can't get up, they can't go to bed, they're not eating, they're almost immobile in a sense. Two very different types of individuals and what they look like. Right. So some of the symptoms that we look for are and I think we talked about changes, and my comment to that is, I think you have to not just look for small changes, because small changes may be happening the whole time. Right. But you want to look for something that's a drastic change. So a drastic drop in weight, a drastic something that's very unlike the individual. So if a person texts you right away and they don't text you at all or for a day, and that's becoming the new pattern, then that's something that you should be alerted to, aside from if they're having some cell phone service issues. That could be.
They cut my phone off.
Yeah, right.
Well, even something like that. If a person is very on top of keeping with tasks, or keeping with paying the bills, and all of a sudden we're not paying the bills on time. All of a sudden you love the spring and to go for a walk, and you're no longer engaging in that activity. So is there a loss of interest? Is there, from outsiders looking in, is there a drastic change for the individual? I think that's crucial. Right. That's something that you can pick up right away, because you know a person's patterns. Right. My clients and my patients know that I respond pretty much almost immediately. When I don't, they say, are you there? Are your kids okay? They go through a list, because it's not the norm of what I'm used to. And so for outsiders looking in, that's something that you can look at. Eating. Aside from if you have medical reasons for changing your diet. Are you eating too much? Are you eating too little? Right. Are you sleeping too much? Are you sleeping too little? Do you have an agitation about the way your psychomotor agitation? Do you have too much movement? Do you have too little movement? What are your thoughts? Are your thoughts in line with your activity? Or are they kind of veering to potentially dangerous, which I think was something that you stated, and I just want to make it pretty clear that just because you're depressed doesn't mean you're suicidal. Right. No. And so I think that has to be
and that's one of the things where sometimes you'll say something and somebody will immediately say, "Oh, you must be suicidal."
Because then they call the cops.
But every time I used to say, and I still do, you know, I just want to go and jump off a cliff. Right. And everybody's like, "Oh, you're suicidal. You shouldn't do that." I'm like, "I want to go hang gliding. I want to soar like the eagles." And so realizing that, you know, what you say can be misinterpreted, and so maybe expanding just a little bit. But sometimes it's in those words that don't make sense. Because when I used to do the therapy with people, I would always, depending on how they said something, if it just didn't make sense, if it came out of the blue, you know, it's like, "Oh, I think I'll give my stuff away." It's like, why would you do that? Yeah, right. You know, so you're starting to get rid of things, which is another sign of there's something going on. You know, especially for somebody who loves their stuff and they're suddenly giving it away. So, so there's a lot of different signs that we can look for. How can we help with it? How can we help somebody
what can a
who's
family
going
do
through
or
depression?
friends?
What alternatives can we offer? As you know, of course, there's medication and going to the doctor, but what other things can we do as a bystander, as a loved one, as somebody seeing it?
My experience of caretakers or loved ones that have someone with depression is they become almost desperate because they don't know what to do. They want to take away what the person is feeling or experiencing. They just don't know how to do it. So sometimes caretakers or loved ones get a little forceful and try to take the reins.
Do it now.
Right, do it now. They'll actually pick up the call and make an appointment for someone. That's not, most offices won't take an appointment like that. They need the individual to be able to make the appointment.
Because you are investing in the appointment for that individual. They're investing, they're saying, okay, I want to get better.
Absolutely. And sometimes family members do have to make the appointment because the person is so depressed that they can't actually lift the phone up. And you'll find that the person's sitting right next to them and you can hear, yes, I want the appointment.
Right.
And so that's very different, and that gives you a very different picture of what's going to be coming through a person's office, whether it's a medical professional, you know, a doctor such as a cancer doctor or a thyroid specialist or even a psychologist. It just gives you a different feel for the type of individual that's coming in, the support system that they have in place, which becomes important. So things that that can be done for patients or individuals that are feeling depressed is addressing it. So not in an aggressive manner, but in a manner in which it's nurturing and loving. And I know sometimes that's hard because your own anxiety gets in the way of being able to communicate what you need for them to do. So that becomes super, super important. The other thing is I like to treat a person very holistically. And so, such as the recommendations you made, I might make recommendations for, I love essential oils. So, potentially essential oils might be in the mix. Yoga, meditation, apps that might be accountability partners. Other things that will provide a structure for this individual to support them in their journey from depression to health.
Oh, that's great.
That's a good one.
Yeah, I didn't think of that. You know, so to relax them in a way with essential oils, with meditation, yoga, on top of everything else, and therapy,
is essential.
Right.
Yeah.
Therapy.
Yeah,
Well,
definitely.
because too, it's not just, you know, here's a pill and you'll be fine.
And you're not.
I
There are
think we
people that take
become
them for years.
Yeah, because we become a society of, you know, here's a pill. We're looking for that quick fix.
Right.
Give me a pill, I'll be fine. You know, whatever the pill's name is, happy pill. I'm going to take a happy pill and tomorrow I'll be happy.
It's not
and
that way.
it's more of realizing that it's not just that pill. That pill can only do so much.
Right.
And it can balance you out. But then, you know, and I'm a big believer on when you're depressed, if you're just taking antidepressants, it does nothing unless you put that therapy in as well. Because you can, you know, I've heard of people, well, I've been on antidepressants for 10 years and it's not working. Well, have you been going to therapy as well? Because there needs to be that accountability, that connection, that piece of moving forward.
Yeah,
as
just
well.
to talk about it too.
Right, and being able to talk to somebody, which is really, really important. And so, what else would you recommend? Other things that people can do, other things that people can recommend or they can do for themselves?
One of the activities, and of course, again, these are things that you should consult a healthcare professional.
We always do that. We are not giving you medical advice. We are just giving you options. And then you go to your doctor and you follow through and you ask all the questions. So even though Dr. Gonzalez is a psychiatrist, a psychologist, she's not giving you a medical treatment. She's giving you all these awesome opinions and advice and ideas. Because that's what we do here.
And things that you can find in the research. So one of the things is to kick up your endorphins. Running is wonderful for that. Some people can't run. Some people have physical physical limitations for the run. So this is why you have to clear it from your healthcare professional first to make sure that this is something that you can engage in. But being able to do that becomes very, very helpful.
And I would say one of those things, and I'm throwing into the running part, but
Did I say yoga?
you know, no, not yet. But the running part is you don't have to run; you can walk.
Right.
And if you don't like walking outside, then put on some salsa and do a little bit of dancing in your house. Put on some music and do that. And you were going to talk about yoga.
Well, two very different activities. So, for example, the reason the dancing helps and the walking, and it has to be to a point where your heart rate is at a therapeutic level so that the endorphins kick up.
It should not take you an hour to walk one block.
Right. Some people consider, oh, okay, well, I love to walk, and they're really strolling.
Right.
I'm not talking
meander.
about. Right.
I meander.
Right. It's not meandering. It's not strolling. It's really physical
Power
activity.
walk, I guess.
It's really a power walk,
Right.
and some people can't even do that. So you may have to look for alternatives to be able to kick up the endorphins. But that becomes very, very crucial. Sometimes finding an accountability partner with that becomes important. Yoga is something that's also very healthy to do for someone that's either anxious and or depressed. Being able to have those moments of peace and quiet and movement and have your body connect with itself in a very different way. We often don't do that.
And you mentioned accountability partner. Can you explain what that is?
Yeah.
An accountability partner is someone that you can rely on to be able to hold you to task.
Oh, okay.
So it's someone that either via text or via phone calls or emails can check in with you and kind of guide you with what you said you were going to do. Okay. So if you say you're going to do something, they're going to hold you accountable for making sure that gets done.
And if you don't have somebody that does the accountability, you could get those Fitbits.
Oh,
because the Fitbits keep track, or even on your phone, they keep track of how many steps you do.
Right.
So today I'm going to do 1,000 steps. Here's your steps. Tomorrow I'm going to do 1,001.
Does it talk to you and say you didn't do it? I was wondering.
No, I don't know, but
I never had one.
Some of them get really fancy.
Oh, okay.
And there's that one that they have now that actually it'll say get up.
Oh.
Time to stand up. Time to go for a walk. Time to go swimming.
Oh, I like that.
You're behind on your, you're 10 seconds behind your normal pace.
Oh, okay.
So it does do that. So in a way, it's talking to you.
Right.
I know that the Apple phone has a system like that, and it does tell you to get up. So if you've been sedentary for X amount of time, it will tell you to actually get up.
Well, my body tells me to get up after a few hours. I cannot sit too long. It feels like I'm jumping out of my skin. I feel like I'm bound and chained. I hate that feeling. So, I have to jump up every once in a while. But
you were doing that yesterday when we were doing the play.
I was going crazy. I got to stand up. I got to stretch. I got to do this. I just can't. I don't know, but that's me. So you do the therapy, and then you do others. So the therapy portion that you do to help people, you take insurance. Your office takes insurance.
Yes.
Okay. And then what else do? You do other things besides?
I have a personal development company, so I like to call it a cousin, because psychology is very focused in on the medical issues, and then the personal development happens to include coaching to be able to empower individuals to get from one point of their life to another, whether it's through their career, whether it's through their business, whether it's just growth that they'd like to make or explorations about themselves that they'd like to make. It's very different.
That's very ingenious.
And we're going to talk a little bit about that in our next show because Dr. Gonzalez is coming back again after this. Because when we start talking, our time is up immediately, and there's so much information that we want to bring you. So we're going to have her coming back again. So we're almost at the end of the show. So if there's a couple of things that you want individuals to take from this show, from ways of them to notice and what to do if they are noticing some symptoms of their own, or if they're not quite sure, then what can you recommend that they do?
One of the things that my office is currently working on, it's a project to try to prevent suicide, and it's called Speak Up to Silence Suicide. And so my recommendation to anyone who may consider that something is going on for them is really, please speak up. There are individuals such as myself, there's other healthcare providers. If you have a good connection with your doctor, with your teacher, with your coworker, is to speak up. No one wants to judge the position that you're in. Something that I've learned in all of my years of doing this is that everyone has problems. Everyone has problems, and so you're not alone in experiencing problems. It's just how do you cope and deal. And there are individuals that are trained professionals. You have your church, you have your doctors, you have your teachers, you have an array of individuals. And similar to what the two of you were saying about the doctors, if you go to one person and they make fun of you or they tell you because they don't know how to deal with it, oh, forget about it, go to the next person.
Right.
And keep speaking until someone hears you.
That makes sense.
It's wonderful.
Yeah, I like that.
Yeah, and it is that part of, you know, I tell people nobody passed Psychic 101, you know, so they can't always read your mind. They can't read your thoughts. They can't know that you are screaming inside and they're just not hearing it. And so being able to say, hey, I need a little help. You know, today's a bad day, you know, and it's the bad day of 30 days so far, you know. So being able to let somebody know, because you never want to say, well, you didn't help me. Well, they didn't know that they needed to.
That's
they
true.
didn't see the signs, because the other piece too is that other person might be going through their own stuff and they don't notice, they don't see it. But so it's really important to follow up. We're coming to the end of our show. So if you want more information from Dr. Gonzalez, please feel free to go to our website, cancertamer.org, www.cancertamer.org, or email us at info@cancertamer.org. And of course, for those of you that are listening in, you know that we're doing the Breast Cancer Diaries, the play, coming up October 5th. For this coming April 6, 2019, we are doing a casting call at the Unitarian Church on Staten Island, 60 Clinton Street.
Clinton Avenue.
Clinton Avenue. Yeah. So make sure that you're there. Come down and just give a message of hope to your loved one, to your friend, to anyone with cancer, breast cancer in particular. From 11
to 2.
And from 11 to 2 on April 6th, we're going to be celebrating, and come with your message. 60 seconds, not a whole hour.
It's going to be fun.
But 60 seconds, it's going to be great. And we're going to celebrate my birthday on the same day.
Woo!
So looking forward to seeing you there. Thanks. I'm Dr. Charley Ferrer, and you've been listening to Cancer Tamer.